Did you know that some nuts in your pantry right now could be silently damaging your arteries? A shocking study in the Journal of the American College of Cardiology found certain nuts may increase heart disease risk by up to 48%. Many seniors believe they're making healthy choices, but the truth is quite different. Some popular nuts could be triggering inflammation, clogging arteries, or even accelerating memory loss without any warning signs. One specific nut, frequently recommended in low-carb diets, has been linked to toxic buildup that harms your liver, kidneys, and brain. This might be sitting in your snack jar at this very moment. Stay with me as I reveal the top 4 nuts every senior should include in their diet. I'll also expose the worst offenders and the #1 most dangerous nut with a health secret nobody discusses. What you learn today might completely transform your approach to healthy snacking. Before we continue, let me know where you're watching from in the comments. We love connecting with our community around the world. Remember to hit that like button and subscribe for more life-changing health information created specifically for seniors. Let's get into the 4 exceptional nuts that deserve a place in your daily routine. Pistachios, the blood pressure regulator. Pistachios may be small, but their health benefits for seniors are substantial. A single ounce, about 49 kernels, delivers an impressive nutritional profile with 6 grams of protein, 3 grams of fiber, and approximately 285 milligrams of potassium. All this comes with just 160 calories per serving, making pistachios a compact yet powerful ally for managing energy, blood pressure, and metabolism. Their exceptional potassium to sodium ratio helps counteract sodium's blood pressure elevating effects. This benefit is particularly valuable for older adults managing hypertension. Clinical research shows regular pistachio consumption associates with meaningful reductions in systolic blood pressure. This heart-friendly advantage is enhanced by phytosterols and monounsaturated fats that help lower LDL cholesterol without reducing beneficial HDL levels. These fats also decrease inflammation and improve arterial function for better circulation throughout the body. For blood sugar management, pistachios offer unique advantages with their low glycemic index. Their balanced combination of protein, fiber, and healthy fats slows carbohydrate absorption when eaten with meals. This prevents post-meal blood sugar spikes, especially important for the 25% of adults over 65 managing diabetes or insulin resistance. Even adding a modest portion of pistachios to carbohydrate-rich meals can positively influence blood glucose response. These vibrant green nuts support vision health through lutein and zeaxanthin, carotenoids that protect the macula and may reduce age-related macular degeneration risk. Lutein is also found in brain tissue, with emerging research suggesting it helps maintain mental sharpness in later years. Those with kidney disease or advised to monitor potassium and phosphorus should consult healthcare providers before adding pistachios to their diet. Always select unsalted or lightly salted varieties to avoid excessive sodium hidden in flavored or processed options. Almonds, the complete bone-strengthening superfood. Almonds have earned their stellar reputation as one of the most nutritionally complete plant foods, especially beneficial for older adults. A single ounce, about 23 almonds, provides approximately 97 milligrams of calcium, roughly equivalent to a quarter cup of milk. This makes almonds incredibly valuable for seniors concerned about bone density and strength. What truly sets almonds apart isn't just their calcium content, but their perfect balance of minerals. They contain magnesium that ensures calcium actually reaches your bones instead of accumulating in soft tissues or arteries. This calcium-magnesium partnership supports skeletal strength without increasing cardiovascular risks. Almonds offer remarkable antioxidant protection through their skin's flavonoids that work synergistically with vitamin E. Together, these compounds create a powerful defense against oxidative stress linked to cellular aging, memory decline, and weakened immunity. The vitamin E in almonds supports skin health while potentially preserving cognitive function. Research indicates diets rich in vitamin E correlate with lower rates of cognitive decline in seniors. For heart health, almonds deliver about 9 grams of monounsaturated fats per ounce. These beneficial fats help lower LDL bad cholesterol while supporting HDL good cholesterol levels. They also provide approximately 3.5 grams of fiber per serving, more than most nuts. This fiber contributes to digestive regularity, nourishes beneficial gut bacteria, and helps control cholesterol. Some seniors may find almond skins difficult to digest. Consider soaking them overnight or choosing blanched varieties if you experience discomfort. Despite their numerous benefits, almonds are calorie-dense at about 160 calories per ounce. Limit yourself to a small handful daily to prevent unwanted weight gain, especially if you're monitoring metabolic health. Select raw or dry roasted unsalted varieties whenever possible to avoid excessive sodium and added oils. Store them in airtight containers away from heat to maintain their nutritional profile and prevent rancidity. Almonds blend beautifully into both sweet and savory dishes. Try adding them to salads, breakfast cereals, or stir-fries. Brazil nuts, the thyroid supporter. Among all nuts, Brazil nuts offer a unique superpower for seniors: extremely concentrated selenium. This trace mineral plays essential roles in thyroid hormone activation, immune function, antioxidant defense, and cognitive protection. Just one large Brazil nut contains approximately 96 micrograms of selenium. This exceeds the daily recommended intake for most older adults, making Brazil nuts more like natural supplements than simple snacks. Selenium is required to convert thyroid hormone T4 into active T3 form that regulates metabolism, energy production, and mood. Thyroid dysfunction commonly affects people over 60, particularly postmenopausal women. These conditions are frequently misdiagnosed due to symptoms like fatigue, weight gain, and forgetfulness that mimic normal aging. Regular but moderate Brazil nut consumption may support hormone balance and optimize thyroid treatment effectiveness. Beyond thyroid benefits, Brazil nuts contribute to neurological health. Selenium protects neurons from oxidative stress through its role in glutathione peroxidase, a critical antioxidant enzyme. Low selenium levels correlate with increased cognitive decline, while improving selenium status may enhance thinking clarity, memory, and mood stability in aging adults. Brazil nuts contain unique fatty acids that help protect the myelin sheath insulating nerve cells. This offers potential benefits for reflexes, coordination, and balance in seniors. Their anti-inflammatory profile makes them valuable allies for joint health. Inflammatory markers like C-reactive protein typically increase with age and associate with chronic conditions. Small human trials demonstrate regular Brazil nut consumption can lower CRP levels, potentially reducing discomfort from arthritis or metabolic syndrome. These nuts also provide magnesium and phosphorus that support bone density and muscle function. However, Brazil nuts require cautious consumption. Their high selenium content can become problematic in excess. Regularly eating more than 2 to 3 daily may lead to selenium toxicity, selenosis, causing symptoms ranging from fatigue and digestive upset to brittle nails, hair loss, or nerve dysfunction. For most seniors, just one Brazil nut daily provides sufficient selenium. 2 per day represents a reasonable upper limit for most individuals. Walnuts, nature's brain-protecting powerhouse. Few foods visually resemble the organ they benefit as perfectly as walnuts do with their brain-like appearance. This distinctive shape hints at their most significant function: nourishing and protecting cognitive health in seniors. Just 1 ounce, approximately 14 halves, provides about 2.5 grams of alpha-linolenic acid, ALA. This omega-3 fatty acid plays a crucial role in maintaining brain cell membrane structure and flexibility. For seniors, these fats are particularly valuable as they support neuron signal transmission and protect against age-related neurological deterioration. Beyond ALA, walnuts contain polyphenols and vitamin E with potent antioxidant properties. Unlike many antioxidants, walnut polyphenols can cross the blood-brain barrier. This allows them to directly reduce inflammation within neural tissue, crucial since chronic low-grade inflammation drives conditions like Alzheimer's and cognitive decline. A clinical study involving older adults found those consuming approximately 1.5 ounces of walnuts daily for 8 weeks experienced measurable improvements in cognitive flexibility and processing speed. Walnuts also contain small amounts of melatonin, which helps regulate sleep cycles. This benefit addresses a common concern among seniors who frequently experience disrupted sleep patterns affecting mental clarity and overall wellness. Alongside brain benefits, walnuts support cardiovascular health by improving blood vessel elasticity and helping regulate blood pressure. Arginine, an amino acid in walnuts, supports nitric oxide production that allows blood vessels to relax and improves circulation to vital organs. Nutritionally, walnuts provide magnesium, potassium, and B vitamins that support nerve conduction, muscle function, and energy metabolism. Though not calcium-rich, walnuts' minerals help reduce inflammatory processes that contribute to bone loss over time. Their high fat content, while healthy, may cause mild digestive discomfort if consumed excessively. A small handful daily provides balanced nutrition without digestive issues. Store walnuts properly in refrigerators or freezers to prevent their delicate fats from oxidizing. If your walnuts taste bitter or slightly soapy, they've likely oxidized and should be discarded. For those taking thyroid medication like levothyroxine, avoid eating walnuts within 4 hours of your dose. Their fiber and fat content may interfere with proper medication absorption. Pine nuts, the surprise taste disruptor. Pine nuts, despite their gourmet appeal and frequent use in pesto and salads, present several unique concerns for older adults. One of the most peculiar effects is pine mouth syndrome. Within 1 to 3 days after consumption, some individuals develop a persistent metallic or bitter taste that can last for days or weeks. While not physically harmful, this effect can suppress appetite and potentially cause unintentional weight loss in seniors, a population already vulnerable to undernourishment. A more serious concern involves potential medication interactions. Pine nuts contain compounds that may affect metabolism of blood pressure medications, antidepressants, and cholesterol-lowering drugs. These interactions remain poorly documented in mainstream medical guidelines, making them particularly dangerous for seniors managing multiple prescriptions. Consistent pine nut consumption without awareness of these effects could lead to altered drug efficacy or unexpected side effects. Another hidden risk comes from their high polyunsaturated fat content. While often considered beneficial, these fats oxidize extremely quickly. Pine nuts spoil rapidly at room temperature or beyond their shelf life. Rancid fats from oxidized pine nuts not only taste unpleasant, but may contribute to cellular inflammation and tissue damage. Seniors with compromised digestion or inflammatory conditions may be especially sensitive to these oxidized compounds. Physically, pine nuts present distinct aspiration hazards. Their small size and slippery texture make them among the easiest nuts to accidentally inhale, particularly for seniors with swallowing difficulties or medication-induced dry mouth. If aspirated, these tiny nuts can block airways or lodge in lungs, potentially causing aspiration pneumonia, a serious and sometimes fatal condition in elderly individuals. Cashews, the blood sugar disruptor. Unlike most tree nuts, cashews contain surprisingly high carbohydrate levels, approximately 9 grams per ounce with only about 1 gram of fiber. This elevated net carb content can spike blood glucose more rapidly than other nuts. This characteristic becomes particularly problematic for seniors managing prediabetes or diabetes. Their seemingly innocent sweetness masks a concerning ability to destabilize glucose levels in older adults with compromised insulin sensitivity. Beyond glycemic impact, cashews present a silent threat through their oxalate content. These naturally occurring compounds bind with calcium in the digestive tract, potentially forming kidney stones in susceptible individuals. For seniors with diminished kidney function or urinary stone history, cashews may quietly increase existing risks. Regular consumption contributes to an internal environment favoring crystal formation and potential urinary complications. Cashews contain fermentable carbohydrates that place them high on the FODMAP scale. This makes them likely to cause bloating, gas, and gastrointestinal discomfort, especially for those with irritable bowel syndrome or digestive sensitivities common among older adults. The processing requirements for cashews raise additional concerns. Raw cashews remain inedible without heat treatment to remove urushiol, a toxic resin also found in poison ivy. Improperly processed cashews may retain trace amounts of this compound, occasionally provoking allergic or skin reactions. Commercial varieties typically come roasted in oils and coated with salt or sugar. This further compounds negative effects by increasing sodium intake and encouraging overconsumption. Their rich flavor and texture often trigger compulsive eating patterns. With 160 calories per ounce, It doesn't take much to exceed healthy daily limits. Finally, cashews contain moderate vitamin K levels, 10 mg per ounce, that may affect blood clotting in seniors taking anticoagulant medications. Peanuts, the hidden inflammation trigger. Peanuts may be among the world's most common snack foods, but they carry numerous health risks for seniors that often go unrecognized. Unlike true tree nuts, peanuts are legumes growing underground, making them uniquely susceptible to mold contamination that produces aflatoxins. These potent carcinogens can damage liver cells over time. Even chronic low-level aflatoxin exposure links to liver cancer and impaired immune function. Seniors with weakened liver function or compromised detoxification systems face increased vulnerability to this hidden danger. Beyond aflatoxin risks, peanuts deliver high levels of omega-6 fatty acids. While omega-6 isn't inherently harmful, imbalances between omega-6 and omega-3 promote systemic inflammation associated with arthritis, heart disease, and cognitive decline. Most older adults already consume excessive omega-6 from processed foods. Adding peanuts simply intensifies this inflammatory burden, potentially worsening joint pain, stiffness, and vascular problems. Peanuts rank among the most allergenic foods. While peanut allergies are commonly associated with children, adult-onset allergies represent a growing concern. Initial reactions may appear subtle, mouth tingling, skin irritation, or gastrointestinal discomfort, but can rapidly escalate. Severe cases may trigger respiratory distress, swelling, or anaphylaxis. For seniors taking multiple medications or with reduced immunity, allergic reactions become particularly dangerous. The typical preparation methods for commercial peanuts introduce additional problems. Most are roasted in low-quality vegetable oils that oxidize and contribute to inflammation and cellular damage. They're frequently heavily salted or sugar-coated, increasing sodium intake and destabilizing blood sugar. These concerns become especially significant for seniors managing hypertension or diabetes. Finally, peanuts are calorie-dense and extremely easy to overconsume. A small handful quickly becomes a bowlful, particularly during social gatherings or distracted eating. For seniors managing weight, fluid retention, or cardiovascular strain, peanuts can secretly undermine dietary progress. Macadamia nuts, the calorie bomb. Macadamia nuts may feel luxurious and indulgent, but they present several significant drawbacks for seniors. Their extreme caloric density stands as a primary concern. Just 10 to 12 macadamia nuts contain approximately 200 calories, primarily from fat. Yet they provide minimal protein or fiber to create lasting satiety. What distinguishes macadamias is their unusually high saturated fat content compared to other commonly consumed nuts. With nearly 3-4 grams saturated fat per ounce, excessive intake could elevate LDL cholesterol and worsen existing cardiovascular conditions. For seniors following heart-healthy diets or taking medications like statins, this added saturated fat may undermine therapeutic progress. Their rich fatty composition places additional stress on the gallbladder. For those with known or silent gallstones, a condition increasingly common with age, macadamias can trigger uncomfortable digestive flare-ups. Nausea, abdominal pain, or even gallbladder attacks may follow consumption, especially in larger portions. Unfortunately, their buttery flavor and soft texture make them dangerously easy to overconsume. Macadamias also present dental challenges despite their smooth texture. Their dense structure can damage weak or artificial teeth. Seniors with bridges, crowns, or dentures may experience discomfort or dental injury when consuming these nuts without proper preparation. Storage represents another overlooked issue with macadamias. Their high fat content leads to rapid spoilage. Improperly stored nuts quickly become rancid and develop unpleasant flavors, indicating oxidized fats that may contribute to cellular damage when consumed. Seniors purchasing macadamias in bulk to save money might unknowingly increase their exposure to these degraded compounds. Choosing the right nuts isn't just about nutrition. It's about protecting your heart, fueling your body with sustained energy, and keeping your mind sharp throughout your golden years. Understanding which nuts support your health and which quietly work against it transforms every snack into an opportunity to take control of your well-being. Remember, perfect nutrition isn't the goal, consistency is what truly matters. As the saying goes, small changes consistently applied yield remarkable results over time. Even one better choice each day leads to meaningful improvements over months and years. Now, I'd love to hear from you. Have you noticed positive or negative changes after adding or removing certain nuts from your daily routine? Share your experience in the comments below to help others make informed decisions. If you found this information valuable, please pass it along to someone you care about. Your health deserves nothing less than the best information available. Hit that like button and subscribe for more evidence-based health strategies designed specifically for seniors. The video appearing on your screen now explores another things that might be impacting your health. Click to watch it next.